Hi, welcome back. And we are still discussing on the research protocol, and our discussion is still focused on quantitative research. It will be the same declaration, so I hope that you will be open-minded in this process of research. Now, going to your quantitative research, the next part that we are talking under chapter 1, the introduction, is your theoretical and conceptual framework. Now, when we talk about your theoretical and conceptual framework, this is where you will be discussing the theory, where you will be anchoring your research. So as you can see, theoretical framework of the study. This study is anchored on the quality of life model by Wilson and Cleary, 1995. And then you should be able to discuss the components or the main idea first of the theory, wherein you will be anchoring your research, and then discuss the specific tenets, discuss the specific statements, discuss the philosophies discussed under this theory that are of particular significance to your research. Okay, so you can say, for example, this study is anchored on Florence Nightingale's theory, environmental theory, which was formulated last. You need to be able to specify the year. Okay, why are we specifying the year? Because there are theories that are evolving across time, and there will be theories that are changed across time. So the 1990 version might be different from the 1995 version to the 1999 version. You should be able to specify the specific date. Then other than that, we go back that this is a scholarly output and you would need citations. Then need to be able to discuss the specific parts of the theory that is of particular importance to your research. And then for the conceptual framework, this will be the part of your research wherein you are applying your theory to the specifics of your research. Okay? An example would be in this study, the child is an individual faces epilepsy is a life-changing process. So his or her quality of life may be affected in cognitive, emotional, social, and physical aspect. So as you can see, in the theoretical framework is discussing only about quality of life. But in conceptual framework, we are already discussing quality of life in the context of a child with epilepsy. Because we are already more specific to a child with epilepsy. Okay, so our discussion is more specific to a child with epilepsy. Um, Another example would be if you will be looking at the progressivist theory of learning by Gregorio. Gregorio might put it simply as knowledge affects attitude, and then attitude would influence the practices. But when we are in the conceptual framework of the study, we can say that in this study, the knowledge about dengue fever is assumed to have a positive impact on the attitude of the community towards dengue care. Uh, Furthermore, the positive attitude could be converted to good practices in dengue prevention. Okay, so you need to be able to discuss as how do you assume this variable A to be related to variable B. Okay, oftentimes you need to present two sides of the coin when you are discussing it. So what do I mean by that? Let's say, for example, in this study, it is assumed that knowledge would have a positive impact on the attitude. For example, if a student nurse is knowledgeable about dengue, that it is highly likely that the student nurse would also have positive attitude towards dengue prevention. However, the contrary may be true. If, for example, the students would have too much knowledge in dengue, but then they would think that dengue is a very serious disease and that they would think that prevention would be not very beneficial. So you're trying to present the two sides of the coin. What are your bases for trying to present the two sides of the argument? You can base it on literatures or existing literatures. Also, a point of teaching that I would want to emphasize is the use of his or her. At present in APA 6 and 7, they have already advocated for the use of the singular they or their. So instead of saying his or her, we don't want to be sex biased. Okay, we don't want to be gender biased. So instead of saying his or her, him or her, you can say their quality of life, their knowledge. Okay, their knowledge is affected. So the use of singular they is already advocated for when it comes to gender sensitivity. So we can apply that in your present pursuit of your research. The next part is the definition of terms. Now you need to be reminded that in the definition of terms, for the definition to be exact, congruent, accurate, and complete, you're reminded that it needs to have four parts. So the four parts of your definition is the conceptual definition, the operational definition, how will the variable be measured, and how will it be categorized. This varies between institutions, as there are institutions that would only have conceptual and operational definition. For the purpose of this example, we'll be talking about conceptual definition, operational definition, how to measure, and how to categorize. Now, you might be thinking, what are the terms that I need to define in my operational definition of terms? Basically, it will be the variables under study and then any term in your study that needs to be technically defined because it could not be easily understood by the reader and the prospect consumers of your research. Now, for example, in the study factors associated with the quality of life among children with epilepsy, the term adherence to medical regimen or medication regimen is identified or defined. So as you can notice, the first component of the definition is the conceptual definition. So in this conceptual definition, you can notice that the term, this refers to adherence to the prescribed treatment by Modi, etc. Okay, and colleagues in 2010. Pardon me for saying etc. It should be and others in 2010. Now, remember that when I talk about conceptual definition, it is the general definition. Usually we would say it is the dictionary definition. So in this case, this is from the literature which was written by Moody and colleagues in 2010. Now, your conceptual literature is usually an exception to your 5-year rule. Okay, that's a point of teaching that you need to remember. Um, since it is conceptual literature, it could have been formulated more than 5 years ago. Okay, so it is considered if it is more than 5 years. Now, what's lacking in this example is the operational definition. So you must be saying, in this study, adherence to medication regimen would refer to the adherence of the children with epilepsy to their medication that were prescribed by the physician. So usually, the term operational definition is started by the phrase in this study. Just like your conceptual framework, so in this case, operational definition, it is started by the term in this study. The next part is how how will it be measured? So it would start by saying it will be measured by a 10-item questionnaire or a 6-item questionnaire, an 8-item questionnaire, which will be answerable by, will it be answerable by true or false, multiple choice, or will it be a Likert scale of 0 to 3 or 0 to 5? Okay, so you need to be able to specify that. And then you need to say how will it be categorized. So it will be categorized as follows. Adherent if the total score is 6 and above, and non-adherent if the score is 5 and below. If your questionnaire is adopted, when I say adopted, meaning we have adopted it from an author who has previously checked or used this questionnaire, or maybe it is another author who formulated the questionnaire, we need to cite the author and we need to follow the scoring guide which was given to us by the author. Again, if it is an adopted questionnaire, it would issue guidelines as to how to score each specific item. So be particular of these guidelines because this is important for you when you will be doing the categorization of your variable. Now, you might be wondering, sir, what if there are variables wherein we will not be measuring it? We will not be doing some measures. So you can simply indicate that it will be determined by asking the respondents to answer. Okay, it will be determined by asking a respondent to check on the tick box, okay, whether they are male or female, and it will be categorized as male or female. Okay, for this is an example for sex. Okay, but generally speaking, most, if not all, of the variables need to be defined in terms of conceptual, operational, how to measure, and how to categorize. This clear, accurate description of these variables would allow the reader to understand what do you mean by adherence, what do you mean by non-adherent, what do you mean by adherent. so that the reader will be able to have a valid conclusion from your findings. Okay, or the reader will be able to explicate how will they be able to use your research findings. Then, the significance. So, when we talk about significance, it basically answers the question, what is the benefit of your study? So when we say significance of the study, we approach it by answering three questions: who, what, and how. Okay? Who will benefit from your research? What will they benefit from it? How will they be able to use that benefit? So always the who, what, and how. So under the who, you need to think specific groups or individual users. So commonly in our pursuit in nursing research or research in nursing, you are considering your nurses, the student nurses, then the nurse educators, then you have the physician. Maybe you would want the local government unit, the future researchers. Maybe you're thinking of staff nurses also. You're thinking of nurse researchers. You are thinking of the mothers of the patients with special condition. You are thinking of the patient themselves, maybe the hospital administrators, the administrators in the school. So these are the possible population who will be able to benefit from our research. Now, if you're able to answer already the who, let's say for example, the nurses, what will they benefit from your research? Oftentimes we would say they will have a basis for the formulation of nursing care plan. Now, let's say, for example, your study is about the efficacy of using banana as prevention for decubitus ulcer. So, through the findings of the research, the nurses will be able to formulate a nursing care plan that will be able to help them to manage, the patients who are at risk for having bed sores or decubitus ulcer. And how? So, through the findings of this research, they will be able to have specific interventions that are evidence-based. Okay? The common loophole that we can notice in the significance is this line. Okay? The common loophole that we can notice from the significance is this line. Try to listen to this by saying, the nurse educators will be able to gain knowledge from this research. Okay? That you need to think twice before you write lines like that. Why? If you are not doing an intervention, how can I enhance the knowledge of the nurse educators? If your research does not have an action plan for the educators, you could not enhance their knowledge. Okay? Now, be careful because oftentimes we are embarking on descriptive, comparative, descriptive, correlational researches. This type of researches does not measure the impact that we are giving to the respondents, or does not measure the impact that we are giving to other sets of population. So we could not say that the nurses or the student nurses will become more intelligent because we did not give them a medication, we did not give them an intervention to make them more intelligent. But instead, we are just making them aware of their current practices, and from that, they might be able to formulate practices that will be able to help them benefit in the future. Okay, so be careful and be careful to think that your research has a causal implication. Okay, be careful of that. Okay, now the next part will be, this is an example of your significance of the study. Okay, so in this part, I am discussing on children with epilepsy and their parents. So as you can notice, I am emphasizing that through the findings of this study, they may be able to identify the significant factors that could affect the quality of life of their child with epilepsy. So to that, they will be able to identify the aspect that is affected, and then they can able to seek support, discuss with other mothers, and approach neurologists for advice. Okay, so as you can notice, who, this is the who. Okay, what can they benefit? This is the what, and these are the specifics, which answers the question how. Okay, now point also that you need to remember in this example is that notice the use of the acronym CWE. You are not supposed to use the acronym CWE if it did not appear first on any part of the chapter. Before you use the acronym, you need to use it alongside with its definition. Okay, for example, this one. Okay, it needs to be cited like that one for the first time it is used in the chapter. However, in the succeeding parts of the chapter, I can already use EIC because on the first part of the chapter, I already indicated the meaning of EIC. So here for CWE in the earlier parts of the chapter, I was already able to mention what's the meaning of CWE. So that's the children with epilepsy. Dear students, also a point for you to learn that CWE is the term that is being used right now. It's considered to be politically correct and non-judgmental. Because when we say epileptics, it tends to show that there is a separation. It tends to show that we are identifying them as a separate group. That's why the technically and politically correct term is children with epilepsy. Okay, in the same way that I do not say that an individual is disabled, instead we say that the individual is a person with disability. So PWD, for that reason. Okay, that's just a point of additional learning in your case. Now, scope and limitations. For the scope and limitations, you need to be able to answer the question, what does your research cover? When will your research be conducted? Where will your research be conducted? How will you be able to gather the data? And what are the limitations of your research? Okay? In other words, what are the factors that you were not able to explore? What are the factors that you would want supposedly to be considered but could not be done? Okay, because it's considered to be a limitation. Now, just as a point of example, so this is a descriptive correlational study that was conducted in outpatient neurologic clinics. So that's the where in Iloilo City. How? It's a one-shot survey. Gather data, okay, to meet the objectives of the study. Who were my respondents? I had pediatric clients aging 4 to 18, okay, and then the data were gathered from the parents. The primary aim is to determine the factors, and this is an example of a limitations. There are several factors that could possibly influence the quality of life. However, I only focused on characteristics, knowledge about epilepsy, adherence to medication regimen, and quality of life. Another example of limitation could be saying that this study could be conducted in a larger scale. However, due to the pandemic, we have confined it to a smaller area to prevent exposure. Or you could say that this study is best conducted in a face-to-face setting. However, because of the pandemic, we have limited it to online setting. You need to remember that the limitation is not a rephrase. It's not a restatement of your scope. What do I mean by that? I could not say that this study covers children aged 4 to 18 as my scope, okay? And then I could not add it as my limitation as all children less than 4 and above 18 are not included in this study. It's not a limitation, okay? The reverse statement of your scope is not a limitation. Take note of that, okay? That is still a scope, okay? So you need to think, what would have been best for my study? However, I could not do it because of certain limitations. Okay? Or for example, if I'm conducting a study in the community and I could say that people in the far-flung areas or people or residents, I mean, who are GIDA, let's say geographically isolated areas or belonging in the GIDA will not be included in this research for safety reasons. Okay? That is a limitation of your research. But you do not say that all who are not students will not be included because that is still the scope. Okay? So I hope that you'll be able to understand that. And then also a point that you need to remember, this is not supposed to be was if you are preparing for your proposal. It needs to be in the future tense. So you say, this descriptive correlational study will be conducted in outpatient neurologic clinics in Iloilo City. A one-shot survey design will be utilized. So that's how you will be stating your scope and limitations. And we are on chapter 2. Your chapter 2, the review of related literature. But you can pause for a while and then wait for the next lecture. Thank you very much for your kind attention. And I hope that you're getting excited to have your research proposal in progress.